Breathlessness during pregnancy is caused primarily by the very obvious issue of your baby creating less space for your lungs. As your baby grows throughout your pregnancy, your uterus starts to push up against your diaphragm, meaning that your lungs can't expand quite as freely as they could before. But that's not the whole picture. The second issue that we have regarding breathlessness during pregnancy is the excess volume of liquid, of fluid that we have in the body. This thins our blood down, and so we have less red blood cells, less hemoglobin, and these are the oxygen carrying cells in the blood. So we've got less capacity to carry the blood around the body, and this is the second cause of breathlessness during pregnancy. So we're going to look at two ways to fix this issue. The first one is to create more space. So we're going to find different places to breathe into where we're not primarily focusing on the diaphragm moving up and down, which it can't now do. And the second thing we're going to do is to look at ways that we can bring more oxygen into the body. So the first thing we're going to look at is how we can breathe more efficiently and effectively into our body, particularly now that our diaphragm is a little bit restricted. So we're going to place our hands onto our ribs, and I want you to focus particularly on the sides of your ribs. So if you can't get your hands this way, turn them the other way. So ordinarily when we take a deep breath in, our diaphragm would move up and down, and we'd get this up and down sensation through the body. And what I want you to focus more on now is this sideways action of the ribs instead. So taking a deep breath in and out. And what I want you to experience is this sensation of the ribs expanding into the sides and then retracting back on the exhale. So if you don't have any movement here, it's likely that you haven't used this part of your rib cage before. So now's the time to wake it up. So as you breathe in, you're going to actively push your ribs and the muscles in the side of your rib cage in towards your hands to wake up the muscles, and then relax them as you breathe out. And after a few breaths, hopefully, you'll find that you've got that nice sideways broadening action through the chest. So now when you take a deep breath in, you're breathing into the lower part of the lungs and then expanding into the sides and then right up into the top of the lungs. So try that a few times and see if you can find this extra space now to breathe into. Now you've worked on creating a more expansive ribcage movement, we're also going to add in a specific breathing practice which can bring more oxygen into your body. This is also one of the birthing breaths that I teach to all my mums, so you can use it for that as well. It's called Ujjayi breath. If you've practiced any yoga before, you've probably come across this before, so just fast forward through this section. If you haven't ever done it before, I'm going to show you how to do it. It's also called ocean breath, as it has this nice oceanic sound to it, which you create by contracting the muscles in your throat. So it's very similar to the sensation that you make when you're sighing under the breath, or if you're trying to mist up a mirror to clean it. And it's that tightening effect in the throat that creates the restriction for the breath. So it sounds a little bit like this. We do it on the inhale and on the exhale. So you can use this breath anytime you start to feel breathless, anytime you feel that you haven't got enough breath moving through the body. We can also just add a very simple chest press to help that broadening through the chest as well. So you're going to take a breath in and push the arms out to the sides. And on the exhale, bring the hands back together. So breathing in and out. And again. So you're actively pushing into the sides of your ribs. All of the movements that are in the heartburn section, so all the stretches where we're taking the arms over the head and we're lengthening the space here, they also work really well with your breathlessness. So integrate some of the heartburn stretches as well. For this next stretch, we're going to use our ball to lean back into. And it's going to work really well to open up the chest and to stretch around the diaphragm and the lower part of the ribs. So this is going to work really well with breathlessness. And it's also a really good stretch to get rid of any rib pain. So you're going to see this video in both of those sections. You need your birthing ball propped up against the wall so it's not going to roll away. And then you shuffle back so that your lower back sits really nicely into the back of the ball. And then once you've got your lumbar spine connected to the ball, you start to lean back. Now for most people, that means your head is going to be really loose, so I don't want you to get any neck pain. So you take a block or two, you put that behind your head. You might even need a couple of pillows on top of that or cushions. And you're going to do whatever it takes to stack up enough height so that you can relax your head. And then once you've got that sorted, you're just going to lean back into the ball. And as you can see, this opens the chest. It gives a little stretch into the thoracic spine. It creates some space around the diaphragm. Creates some space across the lower part of the ribs. And you can stay here for 5 or 10 minutes, breathing deeply.